Hi there, welcome back. And in this, our third part in the series of dealing with a problem with your foot, we're going to talk about what to do at the initial visit with the podiatrist. Now, we're going to assume at this point that you've been to see your general practitioner or you've done some research and you've decided that you're going to see a podiatrist. What do you do now? Well, first thing that we would suggest is that if you are able, bring somebody with you to the appointment. It's always great to have a second set of ears when you're talking to a physician because frankly, a lot of what they may be explaining to you may be foreign to you. You may have never heard any of these terms before. And it's always good to have somebody else who can sit there and listen and possibly even take notes about what happened during the consultation. If you're not able to do that, we suggest that you think about making some notes beforehand. Think about the questions that you want to ask and then ask them. If the podiatrist can't give you 15, 20, 30 minutes to answer your questions before taking the next step, maybe that's not the right person to be working with. Some of the things you may want to ask: what clinical studies is the podiatrist going to use to determine what the best course of action is? Often you'll leave the podiatrist's office after the first meeting and they'll want to do surgery. You want to know, what are they basing the desire to do surgery on? Have they taken x-rays? If so, how many have they taken? What angles have they used? What do those x-rays tell them that supposes or supports their position that surgery is necessary? Ask if there are more conservative measures. Is there anything we can do other than cutting into my foot? If they insist that surgery is the only option, what are the risks? If you've got a small minor bunion that's a little bit irritating, is it worth having a surgery where the risks are that you may never have a normal gait again? You may never be able to walk normally again. You may need more surgeries. How likely are they? And how many times has the podiatrist done this procedure? What complications have the podiatrist's other patients had as a result of this procedure? These are all questions that you're going to want to ask. What we found is that the good podiatrists do not rush into surgery. They try conservative measures, they take lots of films, they do lots of studying to determine what the appropriate course of treatment is before simply operating on a patient's foot in a significant way. They're also willing to sit and answer questions, and they're willing to discuss with you what you need to have answered to feel comfortable moving forward with them. If they're not willing to answer these questions, run for the door, move on to somebody else. If you have questions, feel free to give us a call. We're happy to help. This is what we do. We help educate, empower, and guide individuals in malpractice and negligence cases in New York. And please tune in for the next video in the series. We'll continue talking about what to do after surgery with a podiatrist. Thanks for watching.